This video is about how to stay safe and feelings you might have when there is a violent or unsafe incident in a public space in Vermont. A public space could be a place like a school, a library, a store, a government building, or a hospital. Sometimes violence can happen outside in places like the street or a park. Violence in public spaces in Vermont is rare. If there is violence or a possible dangerous situation in a public space, you might be asked to go into a lockdown. This means staying where you are or moving to a safe place until the danger is over. Teachers, security guards, police, or people in charge will give directions about what to do. If you do not understand the directions, watch to see what other people are doing and follow their example. You may be asked to hide or stay quiet and still. It can be stressful to wait and wonder what is happening. Try to keep your body calm by taking slow breaths or distracting yourself by thinking of things or people you enjoy. Children practice what to do if there is an unsafe or violent situation in their school, so that they know what to do if there is a real emergency. This is called a lockdown drill, and it happens regularly in schools, just like fire drills, where children practice how to get out of the building safely if there is a fire. If a lockdown or lockdown drill happens at school, the school should let parents and caregivers know what has happened. If you have questions or concerns, talk to someone at the school. Sometimes a fire drill or a lockdown drill can make a child feel frightened or stressed and can remind them of frightening things that happened in the past. If you notice your child is struggling with difficult feelings or behavior after a lockdown or a lockdown drill, talk to someone at the school. If you are with your child during a lockdown, your first priority is to stay calm. This will help your child stay calm as well. While the lockdown is happening, it might not be safe to talk with your child out loud, but you can reassure them by keeping them close to you, holding their hand, or making eye contact. Violent incidents and lockdowns can make everyone feel very frightened. They might remind you of times when you have been in danger in the past. When the lockdown is over, the feelings of fear and anxiety that you had during the lockdown could become more noticeable in your body. This could happen later that day or over the next few days or weeks. Trouble concentrating, feeling tense, having no energy, eating more or not eating at all, sleeping a lot or a little, can be signs of the anxiety from the lockdown. For most people, this will get better over time. However, if you have experienced violence or the threat of violence in the past, suffer from depression, sadness, or stress, you may struggle more to overcome the experience of the lockdown. Violence is hard for everyone to understand, and all feelings are okay when a dangerous situation occurs. Remember to talk about your feelings. It is not always easy to understand or share how you're feeling, so be patient with yourself and with your children. Take care to get plenty of sleep, eat well, and try to take walks outside or enjoy nature. Remind yourself that the lockdown is over and you are safe now. If the feelings of fear in your body or mind do not go away, talk to someone you trust about how you're doing. It may be helpful to talk to a counselor. Ask your primary care doctor for help finding a counselor. Doing things we enjoy, keeping to our normal routine, and being with friends and family can all help us feel better. Be patient with yourself. Remember, lockdowns can be really scary, and it will take time for your body and mind to feel better.